Hi, welcome to the Two Nobodies podcast. I'm your host, Rupesh Patel. Did you know that there are people out there who drink their own urine? I was stunned to find this out, but this is an ancient old practice. And I have Coen Kroon, the author of The Golden Fountain. He wrote this book back in the 90s. He's now the director of the Ayurveda Academy in the Netherlands. And just a cool person to talk to about Ayurvedic medicine and his own personal experiences with urine therapy and what that is all about. I encourage you to have a curious and open mindset with this one. He comes at it from a really practical way and provides a lot of context. This isn't a life hack by any means, and he'll be the first to say that. So if you have an open mind and you're curious about what this ancient old practice is, stay tuned because it's a lot of fun. Cheers.
Welcome to the Two Nobodies podcast with my dad.
Coen, it's so nice to meet you. I heard about your work through a friend who was getting into urine therapy, and he's like, there's this book, The Golden Fountain. I was like, there's no way Coen's going to respond to me. You did, and I appreciate it, and here we are. So welcome to the Two Nobodies podcast. You're coming in from the Netherlands, but welcome. I hope you're having a good day today.
Yes, thank you. Thank you very much.
That's awesome. You're in the Netherlands right now. Were you born and raised there?
Yes, I was born and raised in the Netherlands and spent most of my life here. I did spend a lot of time outside of the Netherlands also. I lived for 3 separate years in the United States. And I think I visited India for more than 40 times by now. So
Wow.
if you
More
add
than
up,
me and my family, that's for sure. That's
yeah.
amazing.
Yeah.
What parts of India have you visited?
Actually, all over. It started for me in the north of India. And later on, I went more to the south of India, where the last 10 years I spent a lot of time. And last few months, I was thinking I would like to go back once again to North India, where also this whole story with the urine therapy started for me.
Yeah. And India's just a dynamic place. Was it kind of like a bit of culture shock, I would imagine, when you first
It
went there?
definitely was. I went
Yeah.
there first time in 91, 92.
Yeah.
And I remember that when I arrived at the airport, I entered a world which seemed to be 30 years backwards
Yeah.
from what I came from. And it was really shocking for me at that time.
And now if you've been there 40 times, you would have seen quite the progress, hey, in India?
It's amazing.
Yeah.
India is really developing into a first world and very high tech country, at least in the cities.
Yeah.
Outside, you can still find the old, more traditional India.
Hmm.
But the cities in India have now developed into high rise, uh, high tech cities.
Yeah. There's this sense that I'm getting that people are starting to lose the kind of traditional medicinal practices in India. Um, have you noticed any of that? I mean, you practice Ayurveda. Are you noticing any sort of change where people are not necessarily practicing that as much anymore? They're relying more on Western medicine. Like, what's your sense of like the change there from a medicinal practice side of things?
Yeah, absolutely. Like the Western or English medicine really took over there.
Hmm.
And there's so much to say about it because even Ayurveda, after it came back, after India got its independence, it was structured at the universities along the lines of Western medicine. So that also took away part of the traditional teaching and philosophy behind it. But what I see at the moment is that a younger generation uh, is now there that has an increased interest into exactly that old, strong core of ancient traditions and is
Really?
trying to bring it back based on the ancient books. And that's, of course, something that's very special and precious to India, that it has an unbroken tradition. And it has, even though a lot of libraries were burned throughout history, still there's 10 thousands of ancient texts
Holy.
that still can be accessed today.
Yeah.
And it's quite amazing now. If you look at ancient texts together with IT technology, they start to become more available. So you
Mm.
see a lot of opening up of ancient knowledge and then matching it up with modern findings. So also on a scientific level, they start to do a very fast discovery of that ancient knowledge and how much they actually knew at that time.
That's amazing. I didn't know anything about that. Are those ancient texts? I imagine they're in Sanskrit.
Yeah, they're in Sanskrit. And of
Yeah.
course, Sanskrit itself has been classified in the meantime as a highly scientific
Yes.
language.
Yeah.
It supposedly is the best language if you would have to create computer language from any
Mm.
of the existing languages on the globe. So that in itself is really interesting.
Do you know, like, since Ayurveda and these kind of ancient practices are so embedded in India, is there any desire to, and maybe you kind of alluded to this, to kind of test things out scientifically now? Like here, like in the Western world, there's no money towards this stuff, right? Which is often a criticism for like why the research isn't done on, whether it be Ayurveda or traditional Chinese medicine or other sort of, more, I guess, natural forms of treatment. But in India, I wonder if there is maybe an incentive to kind of test out some of these ancient practices.
Yeah, there definitely is, and there are now some modern institutes that work with evidence-based Ayurveda
Mm,
clinical research, at least in an attempt to set that up in an appropriate way. And of course, there are like smaller clinical researchers, but they want to expand that. And with that, we immediately touch upon the difficulties of comparing it to Western medicine and to Western medicine clinical researches because there's a few major differences, but one of them is that in Western or English medicine kind of research, one will always focus on isolated substances
mm,
for seeing what the effect is, and that you can do in laboratories in fact in a dead non-living context.
yeah.
Whereas whenever you look at traditional medicine, they're always using complex medications. Plus, life itself, our
Mm,
organism is complex.
hmm.
It's very living instead of
Things work
dead.
in systems, right? They don't work in isolation.
Exact.
Yeah.
It's very difficult to do good clinical researches in the line of Western medicine if you
Hmm.
want to really look at the effectiveness of traditional medicine.
Yeah. Yeah. That's one of the challenges, as you said, like, the way we test things out scientifically is often done in isolation, but things kind of are a lot more complex. And if through traditional ancient medicines, we're kind of approaching things through systems, that's definitely a challenge. When you I don't know, when was it that you brought Ayurveda to kind of the Netherlands, and maybe talk about your role right now?
Yeah, when I brought it to the Netherlands was actually after I studied it for 2 years with
Okay.
an Indian physician,
Yeah.
an Ayurvedic physician who has a school in the United States.
Mm,
That is the Ayurvedic Institute of Dr. Vasant Lad. And he moved to United States in 1985 or so. And I studied there only many years later in around 2000 because at that time it was very difficult for me as a non-Indian to study Ayurveda in India.
right.
So I ended up studying it in the United States, studied for 2 years, came back to the Netherlands, and eventually, through some coincidences, started my own academy here. And I'm now working with more than 10 people, teachers in that academy, and we offer a bachelor level accredited Ayurveda program, which is quite
Wow.
special. Yeah.
That's amazing. So it's almost like, you're kind of a pioneer in terms of bringing some of that work to the Netherlands for sure. Like when you're thinking about, okay, like how old would you have been in 1985, if you don't mind me asking?
In 1985, that was not the time that I brought it to the Netherlands. I brought it to the Netherlands after 2000, and then I must have
Okay.
been something like 35 or so.
Okay, but still, like, I mean, okay, so
Yeah.
you're in your 30s, and Did you ever think like, oh my goodness, what am I doing? Or like, this is a big risk, or is this even going to work out? Was there ever any thought about that? Or
Yes, it was, and I'm still running into that because there is a kind of cultural bias against anything that's non-European.
interesting?
So that still keeps it quite difficult to really bring this to the forefront in the full scope that it should be brought forward with.
Yeah.
Because I still think that Ayurveda is really a very holistic, very all-round and
Mm-hmm.
inclusive kind of healing system
Mm.
that doesn't have to compete with Western medicine. On the contrary, it can very well blend together. And then, for the sake of getting more health for patients, that working together would also be very important. And I think it's going to come, but there's a few things that need to shift still. And one of them is that Ayurveda really thinks from another kind of paradigm. And
Mm-hmm.
the other thing is the cultural bias.
Mm. So there isn't there. You're saying there still isn't that kind of openness towards this field.
Yeah, to natural health in general, but
Yeah.
particularly when it comes outside of Europe, then or outside from the Western world, I
Mm.
would say, then people are inborn unconsciously skeptic or
Yeah.
rejecting. Yeah,
Yeah. You kind of said something like, you feel like this healing system blends well. I think that is the challenge too, is just the way we frame some of these other healing systems as like it often gets framed as alternative, right? Whereas
yeah,
I think
yeah,
like a better
yeah.
term is complementary, right? They're
Right,
not like you're not trying to compete in any way with
not at all.
Western or English medicine. It's more of, you're there to support the patient. And if there's an absolute role for Western and English medicine, but that doesn't necessarily mean that it has all the answers either, right? And so,
No,
like, I
no.
think complementary is sort of the better term. Hey.
Yeah, absolutely. And apart from that, you should look at it as a science with its own paradigms. And
Mm-hmm.
um, so blending and looking and learning from each other would be very important.
Yeah.
And I think that small steps are being made into that area at this moment. I was last week at a Ayurveda conference in Berlin
Mm-hmm.
at the Indian embassy. They staged it together with a regular hospital in Berlin,
Okay.
where already the last 15 years they do a sort of joint research into the treatment of rheumatic disorders with both Western medicine and Ayurvedic
Mm-hmm.
treatment. And they just continuously have very good results in that field.
Yeah.
There was another doctor there who was representing a hospital in Germany that treats people with Parkinson
Mm-hmm.
disease. And also, they work together with a program where they blend Western medicine with Ayurvedic treatment. And also,
Okay.
there they have extremely good results. So, the moment these things start to be more documented
Yeah.
and official institution want to stage some exposure platform for that, then slowly it will come more under the attention of many people in a way that it should be brought into attention.
Absolutely. So you said like the Indian embassy kind of helped stage events. So that means that the Indian government is still kind of like interested in this field and is willing to kind of support, Ayurvedic medicine. It seems like, hey.
Yeah, and the Indian government is more than ever interested in that. I think for
Yeah.
two reasons. And one of them is like an authentic reason that they're proud of their heritage and
Sure.
their knowledge systems, and they want to put that also outward and stand for it. And the other thing is that it is a potential export product that brings in cash.
Sure.
Because India has a very big, and certainly in the last 10, 15 years, it has grown exponentially, a very big production business of Ayurvedic herbal medicines.
Hmm.
And Indian government sees what China has done. And China, over the last 20, 25 years, whenever they made agreements with other governments, it included the selling of Chinese traditional medicine.
Hmm. I didn't know that. That's interesting.
Mhm.
That would make
Yeah.
sense. Yeah.
Yeah.
So on that Ayurvedic treatments, like for the lay person who knows nothing about this field, how do you think it shows up for people? Like, what would people be would they commonly think of? I guess that would surprise them that, oh, that's actually that's an Ayurvedic treatment or something.
Yeah, that's interesting. Like, of course, people know it from Ayurvedic teas and skin
Mm,
creams, etc., and also from some Ayurvedic wellness treatments like massage. But if you really look at it, it's a very complex system of physiology that is behind there.
okay.
So there's a science behind there that really looks at the whole body-mind system as a very complex system that regulates itself in keeping up life. And whenever there's a breakdown of that system in any part, they try to analyze where is the breakdown happening and what is the engineering uh, effect of that, or the de-engineering effect in that body-mind system, and then start to undo that. So
Mm,
for that, you need to look at what were the causes of this breakdown, what was the process of that breakdown over years, and then what is the result now, which are the symptoms that people come to when they when they come to see a doctor. So all that is taken into a very quite precise analysis, and
mm-hmm.
then they start to look at measures on how to organically restore that. So not to suppress it with chemicals, but how to organically and in tune with life to restore it.
Okay, so let me break this down a little more. So someone comes in for their first sort of Ayurvedic consultation. What does that typically look like? Like, what does that process look like for somebody?
Well, an Ayurvedic physician or practitioner would ask what are the general complaints,
Mm-hmm.
what are the very extensively asking what is the nutritional habits and the lifestyle habits of that
Mm-hmm.
person, because that all plays quite an important role. And then, of course, also check into what is like family diseases, your own personal family history. So basically, a lot of things that a normal Western doctor would also do if they would have the time to
Mm-hmm.
do a full assessment. And then, because nutrition and lifestyle are considered such important causative factors in the
Yeah.
breakdown of a system, they would first and foremost start to look at how to um, start to tweak that into a more healthy kind of situation.
Mm-hmm.
And uh, aside from that, they work in Ayurveda, and that's what the Ayurveda physician or practitioner would also do, is like try to pinpoint what is the constitution of that particular person, because different constitutions will have different tendencies to go into a disorder, so to
Okay.
speak,
Yeah.
of the natural order. So that will also play a role in what kind of treatments you will start to propose for that person. And that's very interestingly a thing if we talk about blending with modern medicine. Modern medicine is more and more looking into personalized medicine at the
Yes.
moment,
Yeah.
because
Yeah.
they have discovered that people with different genomic makeup will have different reactions to treatments, to medicines, etc. The treatment of men is different than the treatment of women because of
Yeah.
hormonal chemical processes.
Yeah.
So also that needs to be taken into account. And so it is quite full picture that an Ayurvedic physician addresses, and then starts to again to look at like how to temporarily tweak nutrition, tweak lifestyle, and when possible, do that also for a longer term if that's healthier for people. And then, so that is the part that is stabilizing. But then, if there is a disease, Ayurveda, just like Western medicine says, then you need to do a sharper intervention with
Mm-hmm.
medication.
Mm-hmm.
So there is always a misconception that if you use herbs, that it's not harmful and you can do whatever you want. You can pamper around with some herbs. But in Ayurveda, they are very strict about it.
Okay.
Strong medicines are considered to be on a similar level as in the West chemicals. So you need to be knowing what you do if you do an herbal intervention with strong medicinal herbs.
Right.
and you can make mistakes there. So they're very realistic about it. Also, there's other interventions, such as enemas, therapeutic vomiting, therapeutic laxatives, um, bloodletting is
Mm.
one, and um, that might be surprising for many people, surgery. And
Mm.
that uh, traditional surgery also goes back a couple of thousands of years. In the ancient Ayurveda books that are going back to 3,000 years from our times, they're quite precise and detailed descriptions about surgeries, including describing the different scalpels that they used for certain surgeries.
Wow.
Yeah.
Surgery, that does surprise me for sure. So would an Ayurvedic physician be trained to be able to do these surgeries, or how would that work?
Nowadays, because India has this close connection of Ayurveda medicine and Western medicine, um, they will learn that part, but that will be the Western medicine part. And I already told you, like Ayurveda, from its core, is very inclusive. So whatever you can use in the universe as a healing agent or treatment is
Hmm.
allowed, as long as
Yeah,
it fits your therapeutic purpose.
yeah. So in that case, though, then the partnerships with Western medicine physicians, English physicians, is critical, right? Because
Yes. Yeah.
as an Ayurvedic physician, if you feel like a surgery is warranted, you're going to have to really sort of be able to express your concern in your case, I guess, and that person's going to
Absolutely.
that Western medicine physician is going to have to really kind of accept that, which isn't always the case, I would imagine. Hey,
No. No.
yeah, yeah. Um, Part of your treatment, I would imagine, would also be kind of diet changes, like you talk about lifestyle changes, diet changes. I would imagine would be a part of it too.
Right. Diet changes is supremely important because that's with whatever we eat, we build our body
Yeah,
continuously every day. So if we want to have a stable body when we're 80, we have to start making sure that everything goes right at the moment.
yeah,
If we don't, the, we would do the same with building houses. You know, if you want to have a sustainable house, you have to make sure you use good building material and it's well processed in the process of building your house. If you don't
yeah,
do it, your house will collapse.
yeah.
Uh,
So on the well process, have you heard of the field of nutrigenomics?
I have heard a little bit about it, but
Yep.
I'm not very specifically.
No, that's okay. I had a guest probably a year ago or so, and he's a professor in nutrigenomics, and I was just really interested in this field because there is an impact of your genes on how it metabolizes certain foods and compounds. And so you could, we talked about caffeine, and not to say that I don't know if caffeine would ever be a part of any sort of Ayurvedic treatment, but let's just talk about caffeine. He gives this example of how you could be drinking coffee and you could feel fine, and
Mhm,
we often think about like, okay, I feel like I could process this caffeine or this coffee because of the symptoms that I'm seeing.
mhm.
But actually the signs and symptoms don't necessarily reflect what's actually happening when it comes to the metabolism and how that's being
Right,
metabolized in your body. And if you did this kind of screening, these nutrigenomics testings, you could actually determine that whether you have a gene that allows you to metabolize caffeine properly and actually get it metabolized and get it out of your body, and that exists across many compounds. So I guess what I'm thinking about is like, if diet and or the processing of some of these herbs in specific quantities is a key part of Ayurvedic treatment. Like you said, if there are certain genetic inhibitors or barriers to be able to metabolize that, you're not going to be able to probably fully realize that kind of treatment. Hey,
right, and I think exactly there, new research will also be very helpful
yeah.
in both these fields. There is a field in India on universities that is called Ayurgenomics, and that looks exactly into how different body types uh, metabolize things in a different way based on
Oh.
their genomic structure. And they have already found a lot of clues there, which coincide with modern medicine
Hmm.
findings. So that's really interesting, and they're doing this very focusedly at the moment in India with especially diseases that are quite common at the moment. One of them, again, is rheumatic disorders that we already talked about. Other very important ones, metabolic disease, diabetes, and how different body types develop different kind of diabetes, and how different etiological factors play a role in that, including nutrition. So this is all going to be highly important for modern people, I think.
Yeah.
And digestion and metabolism plays a key role in there. We often, if Western people start to think about nutrition, they think about what's on the label of a package. Of course, that's also important to see what's on the label. But in fact, more important is whether you can metabolize it or not.
Yes. Yeah.
You can buy the best organic foods from a health food store, but if you cannot digest it or metabolize it within your tissues, it's worthless.
100%. Yeah. Do you what was I going to ask? When it comes to the kind of cases that you typically see from patients, do you usually get those people who are kind of at the end of the ropes and they're like, I need something different, I want to try something different? Is it usually that the case, or are you seeing more and more people kind of being a bit more proactive and with the approach and come to you folks a little bit sooner?
Both. You actually covered sort of the two major parts of the groups that are coming. There's a lot of people that have tried everything and are very dissatisfied with their normal medical treatment that come to Ayurvedic physicians. Those are difficult cases often because there's a lot going on for these people. There's a lot of disorder for a long time. So to repair that and to restore it, you need to be very realistic and very thorough. The other group that comes is often either younger people or people who have started to do yoga and who got interested in maintaining good health.
I see. Yeah.
That's you see here in Holland, it's probably the same at your end. A lot of people that become vegans because they're really serious about their health. Now we, as an Ayurvedic educational institute, we have to tell them that being vegan can also lead to a lot of trouble if you're not vegan in the right way. And again, if your digestion is not working, then it can go as wrong as any other kind of food type.
Yeah.
So we continuously are working with our school to put people on the track that it's not only what you eat, but how you digest it. And depending on what type you are, if that is the right kind of nutrition for your body-mind type.
Yeah. When you talked earlier about how in India you're seeing more young people kind of maybe switch a little bit back to or consider ancient medicines or Ayurvedic medicine a little bit more, that was a bit surprising for me. I didn't expect to, but then I guess when there are people are getting more into yoga, people are kind of thinking about their health and their fitness in a different way. So maybe it makes sense, but it definitely was a bit surprised by that.
There's been quite a strong promotion in the last 5-10 years as part of going back to Indian traditional values, which is not always what I would appreciate, because sometimes it's a little bit extreme on focused on nationalism. But within that flow, also you see that there's more appreciation for what they call Indian knowledge systems. And that comes with an increased interest in what they call a soft power. And you see quite a number of good institutes that bring that up as a field of study. And there you can really see that young people jump on it and really start to research it with a fresh and modern mind. And then going back into these old systems, suddenly they are the ones that can translate it also very well to a modern world. And that's often what is needed. In the previous generations, people were also quite in tune with this knowledge system, but they were not able to translate it either into Western terminology or into a terminology that was useful for younger people. And now you really see that switch being made.
Yeah. Well, and like you said, there's these other incentives that help kind of push that too, right? Like, yeah, the interesting point about, there is a growing national pride in India, and so that's kind of getting tied into it. But you also spoke about there are these other kind of economic incentives which kind of help
Mhm,
push
mhm.
these. So there might be a genuine interest in the field from a health perspective, but you have these other kind of catalysts that are kind of elevating the field too. Hey,
Yeah, yeah. And
yeah,
one big catalyst in the last 5 years was, of course, also COVID,
yeah, yeah.
where there was a big surge of a big need, in fact, for medicine. And
Hmm.
of course, there was a lot of Western medicine that was being brought forward, whether it worked or not. But that was, of course, the strongest kind of attempt to deal with this pandemic. But uh, India still being rooted in traditional medicine, there was an enormous upsurge of interest in people, at least to maintain their health, to support their immune systems, and from ancient Ayurvedic sources, there was several um, uh, things being brought uh, forward that had to do with pandemics that were
Hmm.
written thousands of years ago. They were describing how to deal with pandemics already back then,
Hmm.
and
Wow.
how important it is that exactly when there's a pandemic, you have to start watching your nutrition, your lifestyle. You have to counter fear. They really describe it as
Yeah.
such. And they say very practically, you have to make sure your nose is as clean and as protected as possible. And we
Mm.
by now all know that this is the entrance
Mhm.
for a viral infection. And if you take care of this part well, even if you get infected, there's a chance that your infection will be less invasive.
Okay, well, you piqued my curiosity on COVID. Like, what would have been like, what would have been the Ayurvedic response to COVID? That's a really broad, general question, but
Yeah,
yeah.
it's a very broad general question, and I think Ayurveda sees also viral infections as real threats for systems
Mhm.
to start out with, so they don't live from the idea that, oh, if you eat healthy and you live healthy, then you cannot be infected. No, they're very realistic. If there's a big infection, everyone can be affected,
Yeah.
and each system can get thrown majorly out of order. Now, depending on the nature of the uh, viral pathogen, you will see different systems, subsystems of the body getting affected. And what
Mhm.
they saw quite quickly with COVID was that it was not just a lung disorder, but it was actually a viral invasion of the blood tissue, and that the blood tissue got very much disordered because of this virus. And that created, because the blood is connected with so many tissues, it could create a lot of havoc into vital um, tissues and organs. So, what they looked at, the people who were in some way dealing with it, was not just to treat the lungs, but particularly to treat the blood with bitters, cleansing agents, etc. And that could also explain why many people had these kind of pneumonias that were not the regular pneumonias. If you have only a lung related pneumonia, it will usually only affect one part of the lungs, and you can put people on an incubator because the other parts of the lungs will take the oxygen.
Mhm.
Now, with COVID, this didn't work at all because the blood surrounding the lungs that was affected, and it seeped in everywhere in the lungs from all sides. And if you put an incubator in there and you start to pump oxygen, you push it back in there. So many people who became on incubators in the beginning of COVID, they actually had not much chance by that treatment.
Mhm.
So this is nobody could know that because it was an unknown kind of viral situation, and
Yeah.
people did whatever they could do best from their knowledge. But I already talked a few months into the COVID pandemic period, with some Ayurvedic physicians said that no, you should really not treat this as a pure lung situation, much more as a blood infected situation.
What are your thoughts about the rise in like these kind of zoonotic viruses and antimicrobial resistance? Like as in the position that you're in, what are your general thoughts on this?
Yeah, it's actually a double kind of thing. Like human beings always live on the verge of being uh, doing inventions
Mm-hmm.
and having the hubris of doing too much interventions into the world of
Mm.
nature. And when we transgress certain borders, the natural disorder starts to lash back at us. Not as a punishment, that would be a religious interpretation, but it's just a natural order that needs
Right.
to be in balance. And there's a lot of interference with natural systems overall
Mm-hmm.
in our modern world. So then things start to become little, yeah, imbalanced all over, and then bigger collective groups can suddenly be subjected to waves of disorder and disease. And this is what happened. And then I don't even know if the virus was a laboratorium created virus, but that would also be a transgression of a natural order. And the interesting thing is that in the ancient text of Ayurveda, whenever they talked about pandemics, they said like whenever uh, dharma or right behavior, and again, this is not a religious kind of approach, but just as natural orders. If they're too much disturbed by humanity, the world becomes more subject to pandemics.
Wow,
So
that's
it's
amazing.
quite a clear view on the wisdom of humanity. And
Yeah,
whenever we start to play too much with that, we evoke a certain risk.
that's amazing.
And
And you know what? Just like there almost sometimes feels like there can be a discounting from sometimes from Western medicine on some of those ancient on these
mhm.
ancient healing practices, but there's so much wisdom there, right? It's like
Absolutely.
why shouldn't
Yeah.
we be
Yeah.
tapping into that?
Yeah.
And it doesn't
Yeah.
mean that everything is still relevant, like we're still learning and discovering, but like can't we just like how we study history to understand and inform, the future, why can't we do the same thing? Like why can't we have an open mind towards that? When when you hear people say that there's no science behind Ayurvedic medicine or other kind of ancient forms of treatment, what's your reaction to that, Cohen?
Yeah, it depends on whether that person is open. As I said, there's like a cultural bias or not. So some
Yeah,
people have already closed the door whenever you
sure.
bring it up. Whenever there is an opening, I always advise people to really sit down with someone who is experienced in Ayurveda and the science behind it, and then compare the paradigms on which the science is built. And most people are actually, and I've seen that with a number of Western doctors, when they are open and they take the time to look into Ayurveda, at some point they often go like, wow, this system actually has much more in store for humanity than Western medicine does.
Mhm.
Because Western medicine basically is very repairing, very mechanical, very reductionistic, whereas Ayurveda basically covers um, nature, agriculture, psychology,
Mhm.
uh, spiritual aspects of human beings, etc. And then when it comes to the body system, again, it's very engineering.
Yeah.
Ayurveda is it on the one hand, it's like um, a science that is rooted in consciousness. So you could call it a spiritual science. But on the other hand, when it comes to treating certain things in the body, it's just as if you're in a garage. You have to
Mhm.
use the right oil for the right machinery parts of the body, and then you'll have effect. And they're very precise in that engineering as well.
Yeah, I appreciate you kind of digging into that and giving that kind of explanation. Before we started this recording, I said that, hey, I'm just going to lightly touch on Ayurveda, and here we are 40 minutes in and we're still going.
Yeah, yeah, yeah.
I appreciate the conversation about this. Your, I don't know if it's journey or your exposure into urine therapy. I've heard you speak about this a little bit, but maybe give folks some context as far as like how you even got exposed to this. And I know you said that you're not maybe regularly doing this anymore or at all, but yeah, just maybe the start as far as how you got exposed to it.
Yeah, yeah, that's indeed. It's also a nice and juicy story. Like my very first visit to India, after having had my culture shock in the first few days, I ended up in an ashram in North India,
Okay.
where after a few days of a spring celebration, we had to get to work because it was an ashram where they did a lot of karma yoga, which means just building things in the riverbed. It was far
Mm,
away from um, civilized world. Like I
mm.
had to walk the last 10, 15 kilometers through a riverbed to end up in that place in the mountains.
Did you know you were
And
going to be doing this at all?
yeah, I knew. I
Okay.
was very focusedly going to that
Okay.
place because people had told me that monastery was kind of paradise on earth. Now, for me, it turned out in the first few days that I was there, it was it showed all kind of other faces. Because first of all, I came there in a period when Hindu nationalism started to thrive,
Mm,
and there was a whole bunch of sadhus that wanted to take over that particular ashram by force because they found they it was their opinion that too many Westerners came there.
right.
So I arrived at a place in the Himalayas where people had told me it's heaven on earth, and it was guarded by the black guys with machine guns from the Indian army
Mm,
at that time. So that was already shocking. So after a few days of going through that and a few other things, I I went to work. We had to carry stones near the riverbed. A wall had to be displaced and rebuilt up somewhere else. And after 1 hour, while shuffling around stones, a big stone fell from 1.5 meters down on my feet. And
ooh,
I was having bare feet, sandals on. And basically, the nail and the skin was off till the bone.
oh God.
So
Yeah.
it bleeded heavily. I
Hmm.
went back to the other side of the riverbed. They put bandage on it and they started to treat me with some antibiotic
Hmm.
biotic cream. And after 3 days, the toe was twice as big, started to become black, and it was hurting continuously, extremely.
Yeah.
And I couldn't go anywhere because there was no hospitals nearby. It was difficult to bring me to another place. So I was really in a situation where I thought like, oh, and then people started to also warn me like, if this goes on with your toe, looking that it starts to turn black, then if
To
it gets really
amputate it.
bad, it might be amputated. And
Mm,
then right on that same day that I was struggling with that, I met a woman also from the Netherlands who was working in the office in
hmm.
that ashram, and she said like, you know what, Koen, what you should do is next time you go to the toilet, you pee in a glass and you take some clean cloth and you soak that in your urine and you bind it around your toe instead of the bandage that you have on there now. And I thought, like, it can't get worse anyhow, so let's give it a
Let's
try.
give it
She
a
was
try.
quite convincing. And
Yeah.
she handed me also a little booklet, which was called The Water of Life, written by a Britishman on the use of urine
Okay.
as a healing agent.
Okay.
Now, this book went a lot further. It was also about drinking urine, but this
Yeah.
was enough for me at that moment.
Yeah.
And I tried it out. And within 2, 3 hours, the pain started to subside. And that was remarkable. It could have been a sheer coincidence, but I
Sure.
just kept on keeping it wet. The woman
Hmm.
also supported me in doing that. So she said she had very good experiences with that in the past, with any kind of infection there. So I thought, like, okay, I'll keep on doing it. And then after 2 days, I took off that bandage, and all the black parts had fallen off. and a new pink skin had totally formed
Wow.
a new cover on the wound. The swelling was totally gone. It looked healthy again, except for one little spot where still some humidity or some moisture was leaking out, and
Yeah.
that was it. In 2 days, that whole toe came out actually as a snake renewing its skin.
Yeah.
It was okay again.
Yeah.
So that really had a big impression on me, and of course I was happy because I thought, like, oh, the worst part is over, and
Yeah.
this looks really good now.
And how long did you continue to do that? Like once the new skin came, did you just essentially stop that sort of urine
I,
soaked wrap or
yeah, I did it a few more days, and then
yeah.
then it looked kind of normal again, and I
Yeah.
left it so I could walk again. The pain
Yeah.
was gone, so that was all. Yeah, that all got a lot better. And in the meantime, I started reading that booklet,
Mm.
and that first of all came as a shock. But sometimes it's the best to read something that's shocking when you're yourself in a
Yeah.
situation
Yeah.
where you're kind of broken open. So
Yeah.
I thought, like, well, if it works for my toe, then if this guy writes about drinking urine, and that many people have done that over the centuries and in
Mhm.
history. Um, okay, so I thought, like, I'm here in India, in the Himalayas. A lot of weird things are happening for me. So why not an extra weird thing on top of it? So let's give it a try.
Yeah.
Yeah,
It's interesting that it was a Dutch woman that raised this to you, hey? Like it's
yeah, very very interesting. Yeah,
yeah,
yeah.
out of everyone that's around you, it's this
In
white
the
Dutch
middle of
woman that
nowhere
brings
in
this to you.
India.
Yeah.
Yeah, yeah, yeah.
Yeah. What do you think it was about like the urine that helped heal your toe? Like because urine, correct me if I'm wrong, there's a few components. There's urea, there's uric acid, there's I think creatinine is part of it, and then I don't know what else is it. But like first of all, maybe what's in urine first?
Yeah, first of all, it's of course the biggest part is just the good old normal water, and
Okay.
then
Yeah.
we have urea and some salts and a whole bunch of other stuffs. And I think that particularly also when you let urine age a little bit, then also ammonia is formed in there,
Mm,
and that's like a cleansing agent. So it's also at that moment also becomes bactericidal.
mm-hmm.
And so I think that combination, together with the urea, which is kind of like can be transformed again into healing tissues, and
Mm-hmm.
as such, it's also used in a lot of uh, um, creams, and
Mm,
even in toothpaste they add it.
interesting.
So urea itself is a very nutritious, harmless substance that can mitigate kind of heat situations in the skin. So for itch, for pain, etc., urea in creams can be very well used. So I think that's exactly what it did. And of course, there's also some salt in there. I think it really cleansed the whole infection, and then started to also create a very fast healing. Now, there's an interesting story related to that, which I heard of later by people who had done some research into urine therapy. And they told me that when a baby is in the womb, then we're floating in amniotic fluid. And that
Yeah.
is basically what the baby is continuously peeing out and drinking up again. So there we are actually floating in some kind of urine like substance. And that in itself you could leave for what it is. But then they had found out that if in some situations they have to do that, like a surgery on a fetus in the womb, that if they did surgery, then they discovered that there were no scars left, or hardly any scars. So they saw that there was more healing taking place uh, in such situations than when somebody would be already born. So that again shows that obviously there's some reaction taking place through
Yeah.
which skin healing goes quite well. And that's exactly my experience with the wound on my foot, that it was healing really perfectly.
Yeah. Do we know what amniotic fluid is? Is it like you said? It's there's urine, but like, is it mostly just that, or what's amniotic fluid made out of?
Yeah, I think it's like 80% of it seems to be like the recycled amount of
Yeah.
urine of the baby, because the lungs are still closed at that time, so they're very small. They don't take in air, but the baby breathes in that amniotic fluid,
Okay.
and it seeps so there's a loop actually
Mm-hmm.
going on.
Yeah.
S- and I think so just to go from there, I think the topic of looping in the body to keep the system going is something that we under evaluate often.
Yeah.
We have an internal looping all the time, and that is what generally is translated as the healing, self-healing system within the body. If something goes wrong here in my head, some other tissue can notice that and start to produce something that then helps to rebalance that, because everything all the time goes in loops. Only when that relooping gets really out of order, we get sick. But till that time, there's a lot of disbalance underneath the surface that continuously through relooping is being repaired.
Okay. That's interesting. I hadn't thought about it that way. That's interesting. This looping kind of effect. Just so I understand, if you're thinking about a fetus, for instance, that looping is that constant sort of urination, but also, ingestion. And would you say that that's kind of a looping effect too?
Yeah, yeah. It's
Okay.
part
So,
of how that whole organism starts to grow itself and keep itself safe.
okay. So I wonder if for people, they're hearing this, they're like, okay, that makes sense. But no longer, we're not in the womb anymore.
No,
We're now urine. If you think about urine on its own, there's no natural looping that happens with just like urine, right?
correct.
We there's this, we all, I shouldn't say we all, but there's this obviously predominant thought that it's a waste product, right? Like
Yeah,
it's
yeah, yeah,
it's
yeah.
uh it's something that, our kidneys filter out, and the kidneys filter the blood, and you get this urine that's created, and so we naturally think of it as a waste product. It's one thing to think of it like, I really appreciate the story you gave, and you talking about what your thoughts are as far as how it healed your skin from a topical perspective. That is like one thing I think people can kind of like, man, that I can get with that. When you think about now drinking urine, it the obviously there is going to be this mental barrier of like, well, that's why would you ingest something that was your body was trying to get rid of? So maybe help sort of bridge the gap for people.
Yeah, and that's a correct way of approaching it. I mean, it is a waste product, but that doesn't make it. Some people, sometimes people connect waste with toxic,
With
because,
toxic,
but
okay, yep.
yeah, but a waste is not necessarily a toxin.
Hmm.
There's a lot of waste products in nature that, if you use it properly, it can become useful. So, and I'm also, even though I tried quite radically out what urine drinking was. I drank my urine every morning for 10 years, full stop.
Hmm.
And in that whole period, I was doing well. It didn't kill me. And I was generally considered to be a quite healthy person.
Hmm.
I still am to some extent, but at some point I also uh, evaluated for myself that it's not necessary to do this looping with a waste product all the time, but just consider it. It was an experiment for myself, but I would
Hmm.
tell other people it's not necessary to do that. Uh, but just consider it as a fluid that is produced by a natural organism that can be a medicine when properly used in the right circumstances, as we do basically with many things, and with many things that are also a lot more dirty, for that
Hmm.
matter. If you look at it, we no, most of us, if we talk about drinking urine, people would go like, bah, yeah. Whereas many people go and drink milk. If you would put both under a microscope, especially with modern milk, in modern milk you would find a lot of pus molecules.
A lot of what kind of molecules?
Pus.
Okay.
This greenish infected stuff.
Yeah, PUS, pus. Yeah.
Yeah. And if you would put urine, it is not sterile, but it is a very clean substance. So with milk, nobody will have a problem to drink it straight from the bottle, and they will never think about, oh, if I look this under the microscope, it would be horrible. With pee, everyone thinks like, oh, that's horrible. So it's a little bit of a psychological bias that we have built into it. And the other thing is that if you just look at the physical makeup of a human being, the pee comes out through the genitals, and the genital area is also an area which creates new life and needs to stay fairly clean.
Right.
So it would be weird if God or the universe would have created the body to combine the creation of new life, either through semen or through ovum and the baby, and put it all in the same place where a very dirty, toxic substance would flow.
That's interesting. Yeah.
So if you just look at that physical anatomical combination of things, you can already see that urine must have also some function to keep that area clean and healthy. And that is different with fecal matter, because some people also ask me the question, if you can drink urine, why can't you eat shit? Now, that's it's a question, but that is really different, because fecal matter has a lot of bacteria and a lot of pathogens in there. And that is not, it's close to the reproductive area, but it's not the same system. It's a different system.
Yeah.
And everyone knows that if there's fecal matter going towards the reproductive organs, it can create a lot of trouble. But that's not the case with urine.
Yeah.
It doesn't create any trouble there.
No, that's a good point. With urine, if urine is our body's way of getting rid of like excess, whatever it might be, or to reconsume that, like is and I don't know, maybe we should talk about sort of what the right way of actually engaging in your therapy would be. But if you're constantly drinking things that are your body is getting rid of because there's excess of it, is there a harm in that anyway?
Yeah, there could be a harm in that, because of course it is, as with any substance that you take into excess, it can disturb the normal processes. So, and urine can be, depending on what you eat and drink, can be quite sour or even pungent. And if you ingest too much of it, it can really give you diarrhea. It can disturb other systems. So there is a kind of protocol for urine therapy that if you ingest it in higher quantities, you need to be very careful about your diet, and you need to be fairly clean in what you put into your body and to what you subject yourself. So, and you will also notice that once you start eating cleaner, the taste of your urine becomes quite mild and easy to ingest. If you eat a lot of meat and drink a lot of coffee or processed foods, then the urine starts to taste rather nasty. So sometimes it has that effect on people that they want to try out urine therapy, and because of the direct feedback of the taste of their urine, they actually have a very strong impulse to start eating more healthy.
Interesting.
Yeah.
So is this something you'd say, like, is this something that would be added to someone's lifestyle change, or would it be something that, like, you just gave a good example of, like, maybe prompt somebody to actually make changes to their lifestyle or dietary changes because of the taste of their urine? Like, would someone start with this, or would they start with, some of those other kind of big changes that need to happen?
I would always suggest people to first adjust their diet,
Yeah.
and then also to make sure that they avoid any too much toxic substances in their life, and then they could try it out for themselves. And I think that for many people, it's already kind of a challenge to just dip their finger in a glass and put it on the tip of their tongue, because
Mm-hmm.
yeah, it's a very interesting, psychologically, it's very interesting things. Like I can tell you that I have been to just parties like for uh, where people converse with each other, and of course then someone will ask me, so what are you doing? And then I'm a little bit careful to whom I say what.
Yeah.
And so
Yeah.
like I have written a book on urine therapy, and they go, what,
Yeah.
and then but, so and at that time I was living in Amsterdam. And Amsterdam is people are doing a lot of weird things, whether it's substance abuse or going out
Yeah.
and do all kind of sexual things.
Yeah.
The interesting thing was that those things were you could talk about, but sometimes if I talked about urine therapy, people would walk out the room, slam the door, and didn't want to talk to me anymore.
Wow, that's
You
interesting. Yeah.
know,
Yeah.
so so psychologically, there's sometimes a really strong aversion built in. And also, this is something that for human beings is really interesting to look at.
You get to
Why
learn
is
how
it?
open people really are, hey?
Yeah, and how, often how twisted a kind of relationship we have with our own body
Mm.
fluids. And then we don't look at what it is face fact, but we react on a sort of emotional impulse.
Yeah. You don't get me as the person who like would suggest that drinking urine is kind of like a life hack, right? Like a lot of people, there's this push towards personalized medicine. There's a huge everyone's trying to figure out how do I what's the next life hack that I can think of to keep myself young or keep myself fit and healthy. You don't get me as that kind of person. Like anything, as you said with Ayurvedic medicine, there's a purpose, there's a clear plan to this. So what would your cautions be to somebody who picks this up, listens to it and like, oh, I should start drinking my urine and this is going to be great for my health. Like what are your cautions or what are your thoughts? How do you advise somebody on that front?
Yeah, I would really advise to what we already discussed, to first make sure that you eat and drink clean stuff, and also to not go into a mode of that anything for that matter in life is kind of like a miracle healing thing. That's not how nature works. We are all beings of context. Our context is very complex, and there's never one factor that can solve the puzzle.
Mm-hmm.
So I would say, like, see if you want to do something with urine as a therapy, uh, uh, approach it as an experiment. See where
Mm-hmm.
it works for you, where it doesn't work. It's a substance like any other substance in the universe, and Ayurveda is very clear. They have their own paradigms about evaluating it and using a substance in the right context, and they clearly say, like, any substance in the universe can be either a poison or a medicine depending on the context.
Mm-hmm.
And I think the same is true for urine.
Mm.
So for some people it will work, but you have to be aware of the full context. And since, particularly if there's health problems, you need to have expertise to evaluate, to assess the context.
Mm-hmm.
You need to contact someone who is an expert in natural medicine to some extent, and not expect miracles from it if you start using it by yourself. Then it maybe it helps for you, but maybe it does something that you don't want, and that would be irresponsible.
Would you say urine therapy could be used for both like acute issues but also chronic issues?
Yeah, I think it can. My view is that it generally works more for acute
Okay.
issues. Yeah, and for chronic issues, you would need really contextual medicine, that you need to take the right plant medicine, maybe also Western medicine
Mm-hmm.
if needed, uh, and that you need the right restoration of tissues. Because whenever there's um, a chronic disease, basically that's a sign that within your body, vital tissues have been damaged or depleted.
Mm-hmm.
And Ayurveda really looks at it also. They have a whole specialized branch which is called rejuvenation, revitalization. That is often what they prescribe as being necessary after an acute infection. It's a really nice flowing back to the COVID situation. You see a lot of post-COVID people at the moment. Basically, the infection has damaged in different person different tissues and systems. And first, a good assessment is necessary. What has been damaged? Then to treat that very focusedly with rejuvenation kind of therapy. And then you see that people really make big improvements. So going back to the urine therapy, if you under evaluate that and you start drinking urine as kind of miracle medicine, it won't undo particular tissue and system damages. So then you might start to live in a bubble, but it could be a very unrealistic bubble as to your needed kind of treatment.
This is fantastic. This is, I think this is what people need to hear when they, on anything, like the approach that you kind of gave on any sort of these quick fixes, or people interpret something as like a life hack. Like you really gave some good, um, just good thinking on how to approach the situation. Are people surprised to learn that you're the author of like this book, The Golden Fountain? You tried urine therapy for 10 years, but do you still drink your urine from time to time, or is you're kind of done with it?
Very occasionally, I know I have it with me wherever I go. That's a good thing to know, like particularly in the world, if things would happen that are like, as we saw recently in Turkey, if there's an earthquake and you're trapped, you can use these kind of things. Or if there's no other medicines nearby, I would definitely use it again. I do use it topically quite often.
Okay.
For example, I'm wearing contact lenses myself. Every now and then I get like really irritated eyes, either because of a light allergy or dust or whatever. And I have tried many things, also like these eye drops, etc. But I still have found that, particularly when my eyes start itching, that the best thing is just take a little drop of urine, put it in my eye, and in no time the itching and the irritation subsides. Same sometimes with blocked ears. When I can't get it unblocked because of earwax and seawater, if I'm in tropical climate, I take a small pipette, and with urine, it's the best way to get it done without further disturbing or irritating my ears or creating infection. So for those kind of things, it really works wonders.
Yeah, I wonder if the ear thing has to do with like the acidic components to urine, because I know that what are those hearing doctors called? Not ophthalmologists; those are eyes.
Eyes.
Anyways, I've heard that in order sometimes to clear out earwax, you could use hydrogen peroxide, right?
Yeah.
Although peroxide, is that acidic? Anyways, I wonder if like the acidic components to urine can help with that.
Yeah, and salt also breaks
The
up.
salt,
It can. But the point is, I've tried it also with salt water, but then often my ears start to feel really sore and painful from the salt.
Yeah.
But urine seems to have sort of the right mixture to do the job and to
Yeah.
heal whatever there is in irritation in the ear at the same time. So that makes it, for me, a very good and useful medicine.
Yeah. If someone is wanting to drink their urine, in terms of actually doing so, like, would it be, when you go for a urine test, they always say like catch it midstream, right? Because you want to clear out things. Would it be similar to that? Like you kind of want to pee a little bit and then,
Yeah, I would follow those old instructions. Like there was a reason for that. I think that the first stream washes away anything that has come into the urethra from outside, and the last part of urine can contain some more sediment. So for that reason, probably they said that midstream was the best to
Okay.
use.
And then in terms of morning urine versus like midday, like morning, obviously I imagine is much more concentrated. Is that sort of,
Yeah,
again, maybe
I
there's a purpose for each for what type of urine you're using, I guess, perhaps, I don't know, but any
yeah
thoughts on that?
thoughts, but they're hypothetical thoughts, and
Okay.
that would be nice to still figure things out
Mm.
on. Um, a lot of the interest in urine therapy came because some scientists in Australia looked into why yogis were drinking morning urine and what hormonal effect it has. And it seems to be that in the morning there's a breakdown product of melatonin in urine that has a certain kind of effect on the whole hormonal system throughout the day. Now,
Mm.
whether that really is like a major factor, I don't know, but it would be an interesting thing
Yeah.
to discover. And recently, there has been a lot of attention by Chinese hardcore scientists into the availability of stem cells in
Mm.
urine. And also there, it would be interesting to see, like, if because of a kind of passive rest in the night, if in
Mm-hmm.
the morning urine there would be a higher um, number of these stem cells in the urine. So that again is an area of research that people are diving into now. So sometimes you see something happening in traditions where you can't really explain it, and
Yeah.
only when then suddenly someone starts to look at it from another kind of perspective, they sort of discover the clue of this.
Mm-hmm.
So I'm not sure if that stem cell theory is going to bring more or is going to shed more light on the use of urine therapy. But it's interesting that these Chinese scientists have or are doing now some work on this,
That's
and that they're
fascinating.
very enthusiastic about it.
Yeah.
Yeah.
Yeah. Uh, Athletes are another demographic where I don't know if you work with athletes at all, but they're always obviously looking for the cutting edge to something. Uh, when I was doing a bit of kind of preliminary research on this, there are videos of people like MMA athletes, and people are like, getting into urine therapy and all this. From an athletic standpoint, is there any edge that drinking your own urine could give you? Do you think?
I don't know. It would be an interesting thing also to look at, because I do know that if you do like high profile athletics, you go over a certain point where some of your body cells are broken down,
Mm-hmm.
and they end up in the urine as kind of like a waste product or a breakdown product.
Mm.
Now, I do know that urea, whenever you take that back in, and I don't know how much of that actually translates also into urea, if urea comes back into the small intestine, it's being re metabolized into proteins. So that is one of the reasons why they say that if people do a urine fast on only urine
Mm-hmm.
and processing all the urine, actually they don't lose a lot of weight
Mm.
because the urea again produces proteins. And that it does so, we know also, but without knowing it, they feed urea always to calves as extra nutrition.
Oh,
So
okay.
whenever you take in urea, it's a good nourishment.
Mm.
So so but whether that would work like this for athletes, I don't know. We would have to
Yeah.
look at that more precisely.
Yeah. Is one more question before maybe move on to the last two questions of the episode. But um is this hard on your kidneys at all? Like digesting urine or yeah, processing urine?
I would say no, but then again comes in the protocol that you have to do. If
Yeah.
you reprocess a lot of your urine, in case one would choose for that, then you have to, and that's also written in the older writings on urine therapy. You have to take a lot of vegetables, fruits, etc., so that this digestion in the kidneys, you start to pee a lot also then.
Mm,
So you don't want to exhaust your kidneys too much. It's
sure.
not good for the kidneys.
Yeah.
So the nutrition you take in those periods needs to be fairly light so that the kidneys can easily process.
Yeah.
And
Yeah.
yeah,
Okay. Final thing, in terms of takeaways that you want people to have when it comes to urine therapy, what do you want people to walk away with?
uh, especially to look at the miracle of nature, and that our life contains more surprises and mysteries than we sometimes tend to realize.
Mm-hmm. Yeah, fantastic. Are you okay to move on to the 2 questions I ask every guest?
Sure, go ahead.
Okay, so the first question, our 5 for dinner question: dead or alive, who are 5 people you'd want to have dinner with? And if you're gonna have them, just wondering if you'd have them individually or as a group.
Yeah, I was thinking about it when I saw that question. I thought like I would like to spend time with them individually, with
Yep.
most of them. And shall I just start with number
Go
one?
for it, yeah, and tell me if you want to explain why you chose them. That's
Yeah,
great too.
yeah.
So,
The first one is a man called Vimalananda, and he was the sort of spiritual Ayurvedic Vedic astrology mentor of one of my teachers, and that teacher is Dr. Robert Svoboda. He was the first American physician, a Western physician, to do a full Ayurveda studies in Pune in India in the
wow,
1970s.
wow,
And he was able to do that because he coincidentally ran into a mentor that was a highly spiritual kind of guy, but a completely undogmatic kind of holy guy. Because this guy was drinking 2 liters of whiskey and smoking a package of cigarettes a day. And at the same time, he had extreme capabilities to do even more. Whenever he drank more, he could do more. So I would be still knowing all the stories about this kind of wizard. I would like to know and meet him in a dinner to really experience what kind of personality he was. Because he must have been a quite powerful and deep person. And also because, and that relates back to things that we've talked about, he was always cooking for himself. He basically said, don't let anybody else cook for you if you are not knowing the art of cooking. And so he would make the most tasty meals, simple but tasty, very tasty meals for anyone who came to his house. And he would refuse to go to any restaurant because he said, whatever the cook is thinking ends up in your food, and that would spoil your mind.
yeah,
So I thought it was kind of interesting
yeah.
stuff. So having dinner with him and a dinner cooked by him would be
Sounds pretty good.
number
Yeah,
one on my wish list.
yeah.
Number two would be a guy called Brian Morarescu.
Okay.
And he has written quite recently, he's a young scientist in the United States. He has written a book with the title The Immortality Key. And he is talking about another kind of meal, namely also the meal of Jesus Christ with his apostles. And they have done now a fair amount of research into that last meal. And they have discovered that in Christianity, in the first few centuries, Christianity being a mystery school, they were actually using a kind of medicinal wine that contained hallucinogenics. So that's and they can substantiate that now by doing research into chemical archaeology.
Yeah.
So they have found quite a lot of interesting things. This guy Brian Morarescu has done also research into the Eleusinian mysteries of ancient Greece, and I am classically schooled myself. My basic studies at university was Greek and Latin, and the teachings of Socrates and Plato are mentioning these Eleusinian mysteries all the time. Now, they have also discovered that some very important nutrition part of our lives, which is wheat, that they were, and barley, that they were making beer of that. And if you, if with the making of the beer, there's a kind of fungus in there, you get a kind of molecule in there that is the molecule from which they basically later synthetically made LSD. So there's now this theory, which is quite substantiated, that at the Eleusinian mysteries, they were making use of this fungus-based molecule made from beer, because it was always in the harvest season or in the beer making season that they had this mystery festival, where everyone went into the temple and had a complete out of their mind experience, which was a secret experience. But everyone would come back and say, like, I have seen the divine.
Yeah. Wow.
So this guy, Brian Morescu, he himself was raised by Jesuits, studied classical languages, and then became a lawyer.
Mm-hmm.
But he spent a lot of time without ever having taken any hallucinogenic himself, to look into what was actually the case with these old mystery schools.
Very cool.
Really interesting stuff.
Yeah, that'd be a fascinating dinner conversation for sure.
Absolutely.
Yeah. Who's number 3?
Number 3 is Hildegard von Bingen. She was a nun in Germany in the 1100s, and she used to have visions at a very young age, but basically she became a big scholar. And I also like it because we tend to, as scientists, we always tend to bring in men, but she has written dozens of books, and also on nutrition and herbs, and all her findings come very close to Ayurvedic findings in terms of humors, physiology, nature, etc. So she has left behind a lot of very useful recipes also.
Yeah.
Both on food level and on medicinals. So
and to
very,
do that
very
in the
interesting
1100s,
woman.
like that's definitely
Amazing.
wow, incredible.
Yeah.
Okay, number 4.
Number 4, Nelson Mandela. Because if we talk about social context, and then in Ayurveda also they say that it's really important to feel connected on a real soul level with your community. And I think, like, if somebody can stay in prison for 40 years under dire circumstances and walk out and still feel connected even with his supposed enemies, then you must have reached a level of knowing your soul, your insight so well, who you are, and that you're not different from anybody else, that I think, like, just to be close to him and to experience him as a human being would be like a great experience.
Yeah, and he's so grounded in his purpose, right?
Yeah, and makes it so normal. It's not like a church kind of religion thing. He just lives it full force.
One of my a couple of guests ago, Prakash Deer, he was a South African defense attorney, and he got to meet Nelson Mandela, and he talks about that story. And he said he knew his wife Winnie very well. So, but yeah, just it's someone I haven't really studied a whole lot, but the more and more I hear about him, obviously we all know what he's done, but the person and the man, just incredible. So
yeah,
that's great. Number 5, what's your last one?
Number 5 is Maria Sabina, another
Okay.
woman, totally not learned. She couldn't read nor write, and she was living as a village healer in the Mexican mountains. And she gave people another kind of meal to eat. So I would like to have my meal on that level. That is magic mushrooms. And she was a poet, couldn't read or write, but she must have been a fantastic person as a healer and a knower of nature.
Yeah. That's fantastic. That's a cool one too. Okay, last question. Besides the circle of life, what do you know for sure?
Yeah, well, I just mentioned Socrates, and slowly I'm moving towards his conclusion that it's best to know nothing, for sure, and that the only thing you know for sure is that you know nothing, And that, of course, has a deeper level as well, because like one of my, we didn't talk about it too much, but one of my other things that I really foster in my life is non-duality and consciousness. And if you really also mentally sort of dissect our reality, then you see that basically everything is fleeting and will pass. But the only thing we know is that we are, and that we are conscious. Those are the only two really solid conclusions that you can make. So I tend to hang out with those conclusions and see what that brings for the remainder of my physical life.
You know, you're speaking like a true nobody here, Coen. I appreciate that. Hey, this has been a fantastic conversation. I didn't know where it was going to go. I appreciate you being vulnerable and just expressing yourself fully and wholesomely. That goes a long way. It contributes to the authentic conversations that I've been trying to have with people on this podcast. So thank you for fully committing to that. I know it's a tricky topic, and even though you've had so many years of experience in both Ayurvedic medicine and urine therapy, again, you mentioned this to somebody who has no idea, and you're going to floor them. But you came at this with a very curious mindset, and you also gave a lot of you didn't just say, yep, this is the cure all elixir, right? Like there's a purpose and a reason for everything that you do and the way you approach your work, and that shows up even in the way you're trying to express the benefits of something like urine therapy. So thank you for bringing that to this conversation. And just appreciate meeting you and getting to know you a little bit better. And you're welcome back anytime to talk about these topics. It's there's so much, as you said, on the Ayurvedic side, there's so much advancement that's happening, and especially in terms of the scientific research into this field, or the last piece you talked about, like there's stem cells in urine that the Chinese are kind of looking into. If you ever feel in the future like there's an opportunity to talk more about this stuff, always happy to have you on. So anyways, thanks for making time for me today. Really appreciate it.
Thank you very much for your openness also.
You bet. Okay, cool. Thanks everyone for joining today and listening to this episode. Hope you like it. Subscribe, do all those wonderful things, and we'll see you on the next one. Cheers.